Okay, we'll get going. So welcome everyone to the September Choosing Wisely webinar. Firstly, I would like to begin by acknowledging the traditional custodians of the various lands that we're all meeting on today and pay my respect to the elders past, present and emerging. So thanks for joining us today. We have Marcy Nicholson from Tasmanian Health Service and doing some great work over in Tassie. So I'll hand over to her to talk us through that.
Thank you very much, everyone, for joining us and for giving me an opportunity to talk about our program in Tasmania. We're all very excited about it. So the Choosing Wisely Tasmania journey essentially kicked off in 2014 and 15 when Dr. Jeff Cowser, a Royal Hobart Hospital ED physician, participated in the ASIM Choosing Wisely working group. Dr. Cowser was very enthusiastic about the Choosing Wisely movement and what we could potentially achieve in Tasmania, and he started engaging with clinicians at the Royal Hobart Hospital. In 2018, Dr. Cowser gained the support of the Royal Hobart Hospital Executive Committee for the Royal Hobart Hospital to become a champion health service. He continued his engagement with the broader health service, consumers, and clinicians. Engagement included presentations at departmental meetings, presentations at staff forums, and targeted stakeholder meetings. Dr. Cowser found that there was an enormous level of support for Choosing Wisely and was able to identify future Choosing Wisely Tasmania champions. Dr. Cowser caught the attention of the Executive Director of Business Improvement and Reform at the end of 2019, who recognised the potential and importance of a Choosing Wisely Tasmania program. The Executive Director nominated one of his resources, me, to assist Dr. Cowser in establishing a more formal program framework to support this work. Unfortunately, COVID struck and all new programs had to take a back seat for a while. We were indeed fortunate to get the focus back onto Choosing Wisely in 2021 and have made significant progress this year. Choosing Wisely Tasmania was formally launched on the 22nd of March after the extensive consultation by Dr. Cowser. The Choosing Wisely Tasmania Steering Committee was established and has been meeting since May this year. The entire Tasmanian Health Service became a champion health service as opposed to just the Royal Hobart Hospital as well. We've now got a statewide governance structure implemented, and Choosing Wisely Tasmania is a key priority project for the Business Improvement and Reform Unit with highest level executive sponsorship and support. Choosing Wisely Tasmania is also now included in the Department of Health's 2-year strategy. We have a dedicated program manager, which is me, for Choosing Wisely Tasmania, as well as a project officer and administrative officer. It's also been agreed that 50% of the savings realised through the implementation of individual projects will be reinvested in the program. We have a formal project management framework in place, and our project initiation and project planning documentation have been developed and endorsed, and this includes the Choosing Wisely Tasmania communication strategy. We also have endorsed tools available. We have the Choosing Wisely Tasmania project initiation process, the project prioritisation tool, as well as project templates for staff to use. We're seeing growing consumer and clinician awareness and engagement, but we know that we need to do a lot more on the consumer engagement piece. We collaborate as much as possible with other jurisdictions, and we welcome any ideas for joint projects or sharing of resources. We've now commenced the project implementation phase for the first 6 endorsed projects. I won't be going into depth into these projects today, and we'll save that for down the track when we can demonstrate our outcomes. But the 6 projects are focused on the reduction of unnecessary coag testing, pre-op testing, CT brain requests, CT spine requests, and cannula insertions. And as well as these projects, we will also be establishing an opioid stewardship program for Tasmania. I wanted to share this slide with you to better illustrate the scope of the Choosing Wisely Tasmania project. Tasmania may have a small population of only around 541,000 people, but our state is roughly the size of the Republic of Ireland, and it can take around 4 hours to travel from Hobart in the south to Burnie in the northwest of the state. For the first phase of the Choosing Wisely Tasmania project, we'll be focusing on the 4 major public hospitals in Tasmania. And you can see those 4 hospitals on your screens now. So why did we want a statewide program? We wanted to see equal representation of all Tasmanian regions. We want statewide collaboration and sharing of expertise, efficient use of central departmental staff, standardisation of our projects across the state, capacity building across the state, and we also want to see statewide reduction in the unnecessary imaging pathology tests, prescriptions and treatments, statewide reduction in variations in practice, and greater consumer satisfaction and engagement at a statewide level. So this is what the Choosing Wisely Tasmania governance structure looks like. The Choosing Wisely Tasmania Steering Committee reports all the way up to the Health Executive Committee, which is the Peak Health Governance Committee chaired by the Secretary of Health, who is very supportive of the program. The Choosing Wisely Tasmania Steering Committee membership includes the Chief Executives of all the major Tasmanian public hospitals and the Choosing Wisely Tasmania Clinical Lead, which is Dr. Jeff Cowser. We're hoping to have a consumer representative on the committee in the near future as well. To ensure that we engage with external stakeholders as much as possible, we've established the Choosing Wisely Tasmania Collaboration. The collaboration membership includes the CEO of Health Consumers Tasmania, representatives from Population Health, and also Primary Health Tasmania. We have clinical and business reference groups too. These groups provide advice on project briefs and proposals before the steering committee considers them. And they include subject experts in finance, communication, safety and quality, and many clinical experts as well. Our projects are grouped under 5 banners: prescribing wisely, imaging wisely, testing wisely, treating wisely, and the newly established engaging wisely. We established engaging wisely in recognition that we need to do more work on consumer engagement. We're hoping to embark on consumer-focused projects that may include, for example, partnering with our health literacy expert in population health. So what did we do to ensure a successful statewide approach rather than a facility-based siloed approach? The Choosing Wisely Tasmania program team forms part of the Business Improvement and Reform Unit and is not facility-based. The BIR unit pursues long-term health outcomes and do not routinely react to immediate issues like winter bed demand. The steering committee is chaired by the Executive Director BIR and not a Chief Executive or other executive member affiliated with a specific facility or facilities. Each region will lead one project at any given time. For example, Hospitals North with Launceston General Hospital will lead the CT projects as it is known that they have seen a big increase in CT requests for ED patients. So in other words, we try to get the region with the most vested interest in a particular project to lead the work. While one region may lead a certain project, the project team will always consist of clinicians from all the regions. Different regions have different communication platforms and networks at this stage as well, and we had to consider this when we developed our communication strategy to ensure that we successfully reach our target audience. This slide illustrates our project initiation process and demonstrates that our program is clinician-led and that multidisciplinary input is sought right from the start. The clinical lead and program manager ensures that a statewide lens is always used when considering projects and developing the project briefs. Our endorsed project prioritisation tool sees scores allocated for projects that can be implemented statewide to further encourage a culture of statewide collaboration. Stakeholder engagement on a statewide basis can be very challenging and needed very careful consideration. We're currently using the following methods to engage our internal stakeholders. We distribute a quarterly Choosing Wisely Tasmania newsletter to all staff and make it available on our new departmental internal comms platform. We also make it available on the Choosing Wisely Tasmania intranet site. Champions and potential champions are targeted directly as well. It really does help to have a program and project team that has worked with clinicians within the organisation before. For example, I've worked with clinicians on projects for more than 10 years in Tasmania and know a lot of the senior clinicians very well. Rapport with the clinicians and positive existing relationships are really helpful in this regard. Having an enthusiastic clinical lead like Dr. Cowser is also invaluable. We're hoping to increase the promotional materials displayed in our 4 major public hospitals. We've created email distribution lists and continue to expand on these to ensure that we provide feedback to our senior clinicians and champions after our steering committee meetings. We use the newsfeed on the intranet for important announcements, and we ensure that briefing papers are provided to relevant committees when required. We deliver presentations to relevant groups when possible, and we really hope to organise some roadshows across the state in the near future to afford all staff from all regions the opportunity to engage face-to-face with the program team. We've provided a briefing paper to our Minister for Health and liaised with his advisor to answer questions. And you can see on your screen now just a shot of the signed issues brief signed by the Minister. We also continue to engage with Primary Health Tasmania, Population Health and Health Consumers Tasmania through the Choosing Wisely Tasmania collaboration. It's my hope that we'll be able to set up a public Choosing Wisely Tasmania site in the future to reach more health consumers, and we're having discussions with our Department of Health Communications team about the potential for social media to be used to promote our work. We have learned a lot of lessons so far. Active engagement at all levels is essential. We engage with NGOs, coalface clinicians, our health executive, and the Minister's office regularly. Partnerships are required between clinical and administrative or project experts. Clinicians are already time poor and should not be bogged down with the project management paperwork and navigation of bureaucratic processes. Use different pitches for different people. Make sure your messaging reaches and appeals to your target audience. Change management is critical for sustainable results. If you don't focus on the change management, staff are likely to revert back to their old ways once the project is closed. Use existing systems as best as you can and input into digital health strategies to include systems in the future that would enable change. Ensure that consumer engagement is focused on as strongly as the clinical projects. We've done this by dedicating a resource to this portfolio, and we think we're more likely to see success. It is important to understand and appreciate the competing organisational priorities and ensure that secondary benefits are well understood. For example, if your organisation's focus is on patient access and flow, ensure that there's a clear understanding by all that the Choosing Wisely program contributes to better access and flow as well. Insist upon systemic, sustainable solutions that are not dependent on individuals. Make sure that you build capacity across your organisation. Agree resourcing upfront for projects and ensure capacity to deliver is as clear as your objectives. We've included consideration of resources in our prioritisation tool, for example. Document the program by providing regular status reports and briefing papers. This will help to sustain the authorising environment by making the program a priority, from community through to clinicians, executives, and all the way to the Minister for Health. Now that our program forms part of the department's 2-year strategic plan, we expect to maintain highest level executive support and focus. So where to next for us? We want to complete our quick win projects as quickly as possible. We are focusing on increasing consumer engagement. So as I've mentioned before, we've established Engaging Wisely. We've dedicated a resource to focus on that. And we're going to start collaborating with other public service departments like our Department of Education as well on this. We want to ensure sustainability. We want to embed this into our business as usual, safety and quality audits, etc. We want to better utilise our existing systems, for example, Track ED. So we're trying to get a better understanding of what we can do with that system to help us to reach our goals. We will continue clinician engagement. We want to establish a mechanism for identifying and reducing all aspects of low-value care within the health service. We're about to conduct health professional and consumer surveys as well. We want to evaluate our results and make it known. And we will remember to celebrate our successes and give credit to all those who made it happen. Does anyone have any questions for me?
Thanks so much, Marcy. That's great. And it's so exciting to see how much progress you've made as well. If you have a question, please raise your hand or post in the Q&A. And I'm just going to try to unmute Jeff Kauser, who's actually, I know you're there, Jeff, sitting there with your chin. So there we go. Actually. Oh, cider. So if you have any questions for Jeff, He's actually dialed in and he's on leave for a year. So that's really nice of you, Jeff.
I don't think there's anything for me to say. I mean, except to make the point that where Tasmania is heading, which is really exciting, could not have been possible without Marcy's involvement. I mean, I've been working with the clinicians, and as a clinician, that's all I know. I don't know anything about what Marcy's been doing, but yet the project would not have been possible without what she's been able to do and what she's been capable of doing, which is just blows my mind. The thought that if I had to do any of that would just scare me. That's not what I can do. And so I think that's a model for a lot of things, I believe, and where clinicians have clinical ideas, and we need people like Marcy to make them a reality and embed them in the system with all the governance structures and all these other amazing things that is secret squirrel stuff as far as I'm concerned.
Yes, definitely. You've both done so well. Okay, I'll just see if there's questions. I think you're just getting a lot of compliments there. So Deb, the slides will be available. If you want a copy, just email me at amartin@nps.org.au, but we are recording this and we'll make it available on the website once we have that up and running.
I saw a question there about how many FTE we've got in the team. So at the moment we've got, let me just think. So we've got, I'm fully dedicated to the program, and we've also got, I think it's around a 0.8 of a project officer position and about a 0.5 of an administrative position. And hopefully, as we start realizing savings when we implement our individual projects, we'll have more funding available and we can continue to second staff to work on the program with us.
Great, thanks, Marcy. So just while we're waiting for questions, can you talk us through, I think you have your slide where you have the different structure with prescribing wisely, imaging wisely. Can you talk us through, I guess, why you've gone with that approach across the state?
Well, we before we implemented our structure, we had a look at what other jurisdictions had done, and we actually saw a structure, I think it was Wide Bay had, where they had, I think they had three or four groups like that to group their projects under. So we use that as a starting point because we want to make sure that we've always got a project for each of those project banners going, so that we don't end up only with projects that are focused on pathology. We want to try and focus on all the different categories. And then we added engaging wisely because we believe that we tend to, so we try to embed the consumers within in our committees, etc. But we believe that there are some excellent projects that we can focus on that may not lead to any savings, but are absolutely critical to a successful program. So we think, we might have. We're thinking about ideas at the moment. We might start campaigns like, doctors have one coffee with a patient, every now and again, and try and reconnect with what's important to them, that kind of thing. So yes, really it was about grouping our projects, different projects under those banners, and then our project teams form and then disband as projects are initiated and then completed. So we'll pull the relevant clinicians in to work together statewide on the projects, and then when the projects finish, that group will disband and a new lot will form to work on a new recommendation.
All right,
does that answer your question?
Yes, no, that's a good overview. Thank you. So I've got a couple of questions. Nazila has asked, are you also addressing medicine used for the treatment of COVID?
We haven't really looked at that in Tasmania. And I suppose it's because we've been extremely fortunate in Tasmania to not have much of an impact or a lot of COVID cases here. In fact, we haven't seen an active case here for over a year and almost a year and a half, Jeff. So no, we haven't really focused on COVID specific projects.
Thank you. And a question from Suzanne Child. So have you got any hot tips on re-engagement after COVID response? We may need that in New South Wales. as our teams are focused elsewhere at present?
Yeah, I think that is why we thought it was really important for our Choosing Wisely program to not be sort of embedded in the operational health system so much. So while we wanted to be clinician-led and driven, we wanted the executive support to come from a layer above that, so that there's always a long-term vision, that we don't simply react to the immediate issues that we've got. So in terms of re-engagement, I think if you can find ways to demonstrate how your Choosing Wisely projects will deliver outcomes that are much needed after COVID, and you can demonstrate that to all the way through your organisation and up to your Department of Health, etc., you'll likely find that one executive member that gets particularly interested and is willing to support and sponsor your program. That's what we found with our executive director for business improvement and reform. And once you've got that one executive sponsor at a high level, you tend to get openings to go and talk at higher level executive committees, etc., and get that buy-in.
Thanks, Marcy. And Jeff's just made a good comment where COVID's actually been a good opportunity to really get Choosing Wisely up and going. Can you talk us through, I guess, Jeff and Marcy, you both played a role in gathering like the different clinical champions across the state. Can you give other, like just say local health districts, a bit of advice as to how you approach that?
I think I might leave that one to Jeff. Jeff's done such an excellent job with that.
I would have had hundreds of coffees with numerous clinicians in numerous places, numerous times, and just get out there and talk. So that by the time Marcy got involved and the department got involved with some top-down resources, we were ready. People were all primed and keen to do it. So I think it's as simple as that. Just get out there and talk. You can send have all this promotional stuff. You can have emails. You can have, social media campaigns. But just getting across the table from somebody with a cup of coffee and just talking about, gee whiz, we do a lot of stupid stuff, I think makes a huge amount of difference. And that's, I think, I don't know, that personal touch is so good. And I think that's made a big difference. So that's all I'd say. Have a coffee budget. People have said, oh, Jeff, a couple of people have said I'm looking at organising a job out of the ED for me. I said, no, I need to keep doing my emergency work and run this off the side of my desk, because that's what gives me the street cred to go and have those cups of coffees. In the same, like the chair of Choosing Wisely Australia, David Rosengren, I don't know if Dave's out there, but, he said the fact that he still does one shift a week in the ED gives him enormous credibility when he's running the Royal Brisbane Hospital, because everyone gets quite surprised when he turns up at a trauma at 2:00 in the morning up in the theatre. They go, oh my God, you're him. That sort of thing. You've got to have that clinical cred to do what I do, and also have, and really got to come back. This is all about Marcy today. She's driven that top-down event, and that's really important. Together, it's essential.
And I think it can sometimes be as simple as, if you've worked with a clinician on a project outside of a Choosing Wisely agenda once upon a time, and you had a good working relationship, and you know that you can call that person, start with that person. Start with that person and see what you can achieve. So, for example, if we had no awareness of Choosing Wisely and I had to find a champion other than Jeff, I would know that there's the head of cardiology that I've worked with on quite a few projects, and if I call him and have a chat to him, he will do his best, because I know that he will see that would be a worthwhile thing to do. So think about people you've worked with, start with one of them, and just work your way through. Get to a departmental meeting, go and do a presentation, have a chat to them, and just grow your network from there.
And humility is important as well. I'm always upfront about how I've been doing stupid stuff for 28 years now, and I recognise that, and I'm finally doing something about it. So that's really important.
Thank you both for the tips. There's a question there from Charmaine in WA.
I saw that one. It was about how are we getting the costs, how do we get the costs back into the program, I think is what you want to know. So this is why we actually including our finance people on our business reference group. So what we're going to try to do is right up front when we do our baseline audits, we want to get an agreement with our finance team that this is what baseline looks like. We're now going to have an intervention, and if we demonstrate a success at the end of that, we want to agree on what that means in terms of savings, and then they will be able to take 50% of that and reinvest it into our program, and the other savings will go back to the bottom line for the organisation or that specific department. I'm not 100% sure what they'll do there. I tend to think it should go back to the department that worked on the department budget that worked on the project. So we'll see now with our first 6 projects how that'll work, whether we'll get agreement that the savings will only be for the first year. So you demonstrate savings, you get the 50%, and then that's it, or whether it'll be an ongoing, whether we'll audit on an ongoing basis. That remains to be seen, but at least we know that we will be able to get 50% of those initial savings back into our program. So get the finance people on board. They'll know how to do this.
Great, thank you. So I think that was the last question. Thanks so much, Marcy. That was a fantastic presentation, and we'll be hearing again from your team next year once you have some evaluation results for your specific projects. And thanks, Jeff, for your tips as well. If
anyone would like to chat some more, have any further questions, I'm very happy for Anne-Marie to provide my contact details to you guys. I'm always happy to have a chat, always happy to collaborate, happy to work together on things. So please just flick me an email and I'll see whether I can help.
Right, thanks so much for the offer. So if anybody wants to contact Marcy, you can email choosingwisely@nps.org.au and we can link you in with her. Thanks so much, and we'll see you in a month's time.